Hello, everyone. It's a great pleasure to be here with great colleagues and special guests from Australia. And I am Guilherme Bersou. I'm from São Paulo. We have here Dr. Nick Moncrieff. It's a great pleasure to have you here. We have Dr. Márcio Wallace. He is at Rio de Janeiro. He's a great plastic surgeon. And Dr. Moradi is also from Australia. They are all great surgeons, and it will be a pleasure to talk with you guys this morning.
Thanks for having us.
Thank you.
Okay, let's start talking about how do you see the future of the plastic surgery? And you can introduce a little bit yourself, like talking what you do most and what you think about the future. I'm a little bit concerned because all of us here, guys, are doing breast surgeries, breast augmentation, and especially in Brazil, we have some problems with women's going to Instagram and start to talk bad things about the silicone and stuff like that, and the BioCA. So I want to hear a little bit about what you think in the future of the plastic surgery. So start with you, Nicky. Introduce yourself, talk a little bit where you do your practice and stuff like that.
Thanks very much, Guilherme. My name is Dr. Nick Moncrieff. I'm a plastic surgeon in Newcastle, which is 2 hours north of Sydney on the eastern seaboard, eastern coast of Australia. And I have I've been in practice for 15 years. I have a fairly large breast and body practice only. I do breast and body. And I've been very lucky, I guess, in Australia, throughout my career, to see a real rise in plastic surgery, and we certainly have benefited from the wave of popularity that's hit. I'm sure it's the same here in Brazil. So we've been very, very fortunate, and it's been really great for us. I mean, in regards to where I think it's going, the social media is obviously a blessing and a curse, I think. It certainly helped us grow our practice because we're not in a major city. We're in a large metropolitan area, but it has, this digital reach has allowed patients to come from areas not local to where I live.
Okay.
So that's been really good, and we have got a practice that's now all over Australia, some international patients. So that's been very good. I think on one hand, in Australia now, though, there's a limit on what you can advertise on Instagram. Yeah. So that's made things a lot harder, and we've certainly seen that's coincided with a drop-off, for certainly in me, in some of the aesthetic breast work. I think you've just got to live within the parameters of what this is what the government sets up. It's not easy, navigating this now, but certainly for me, I'm sure Ziggy's the same. We've benefited from social media. It's being able to put out before and afters digitally. Your reach is so much bigger than it would be if it's just coming through a local GP, general practitioner.
Yeah.
And what about you, please?
Oh no, after you. We'll go clockwise.
Yeah, it's okay. I agree with my good friend Guilherme because the social media is a little bit tricky sometimes, right? Because it's just like Dr. Moncrieff said. Sometimes it helps a lot, and sometimes it can make you have some concerns, like Guilherme Bersou just said. So I think it's good to have a good practice and to show people what you can do, but sometimes you have to know how to deal with all the complaints. And of course, I always say to my patients, if you go to my social media, you are not going to see people complaining about me, and it's not because all my results are perfect or are brilliant, but it's because I take care of my patients, so they feel like this. Okay, my doctor is taking care of me, so I don't have to go to the social media to complain about it because he's taking care of me. Of course, we don't have all results are perfect, or of course we have to make some recase, right? Like do it again. But I think that's the most important part. So we can protect it because otherwise, we will have many patients complaining. So it's okay because not everything is perfect, right?
Yeah, I think I actually think the biggest problem for what we don't realize is all the private, closed Facebook groups that we have no access to, and the issue with those, yet again, it's a blessing and a curse. it's a blessing because patients advocate for you.
Yeah.
But also, like anything in social media, you could get patients that you've never operated on for some reason. They can defame you and say whatever they like on these private Facebook groups. You're not aware of it. You can't control it. So I think these private Facebook groups are a big problem as well, because there's a lot of misinformation and disinformation that you can't control. And if you try to control it, they out you. They go, okay, you're and to be able to get onto the Facebook group, you have to be a patient. Your doctors can't get on. So,
is there any regulation about those Facebook groups?
The Facebook groups, no, but I'm pretty sure that the admin are liable as well if in Australia.
Okay.
So if defamation happens, the admin can be sued in Australia for it. So there is a little bit of a safety for surgeons and for doctors alike. But we, in last year, 1st of July last year, our government brought in very strict social media rules for us.
Yeah.
So much so that they threatened people's medical registration if you didn't abide. And I think Nick was saying it before. So for us in Australia, we cannot show any photos of patients in lifestyle photos, gym wear, bikini wear. Yeah. If a patient sends a selfie, we cannot use patient selfies. We can't. The clinical photos have to be before after.
Okay.
You have to do the before photo as the first photo on Instagram. You can't do the after photo as the first photo.
Okay.
You know how you could. I got a letter from the government, from the medical board. Your photo, you have after first, and you have to have before first.
Yeah.
You can't use emojis. You can't say happy patient. You can't say transformation.
Yeah.
So they've gone really left wing.
I heard that they cannot even be being tagged.
Really?
Yeah.
So if you are
They-
tagged,
they-
you have
that's
to
right.
remove
That's
yourself.
right.
Yeah.
So if one of my complaints 3 years ago, a patient on her Instagram said, "Thank you, Dr. Moradi, happy patient." I got in trouble.
Yeah.
I had a surgeon in England tag me and said, "Happy patient," and they said, "Because we're not allowed to say happy patient, we can't make decisions on their mental well-being." So I got in trouble. I got a letter saying, 3 years ago, Dr. Muhammad in London said, "Happy patient."
Yeah.
I get in trouble.
Yeah.
I don't know if you agree, you all, but I think that now we are having a movement all over the world, and it's becoming really clear. You go to right or left.
Yeah.
So some countries, they are allowing us to do a little bit more of advertisement and to show a little bit more of the patients and things like that, like the social style. She's on the beach with the bikini and everything else. And other countries are becoming more restricted. Do you agree with that?
Yeah, I think that's very much the case. Certainly in the Western nations, Australia, US, England, and parts of Europe, has moved way more left, and there is a movement. I think there's a very good point that, people are finding it. Well, people want to tell other people what to do. They want to tell people what to wear, and this is very much the case. And it's just, for want of a better word, the zeitgeist is the culture in these Western nations. Whereas I'm sure in South America, Brazil, there's less restrictions, regulations on this. And as there should be,
It's becoming a little bit easier now, but it used to be very hard,
Yeah,
Yeah.
right.
Very
Okay, I didn't
difficult.
realize that.
I was talking with you guys. We lost a lot of our Brazil place in the plastic surgery, and lots of people start to go to Colombia because they could show their results, and we lost this in Brazil because nobody wants to come because I cannot see the results.
Yep.
Yeah.
So then we change a little bit. Now we are allowed.
Yes.
But it's not like the way we want to.
It's very restricted.
Very restricted.
Yes.
The crazy thing about plastic surgery is that it lends itself to before and afterwards and results. The whole specialty is based on that. So that's why, in a way, Instagram has been very good, because it's allowed us to disseminate our message. But then when it's restricted, it's sort of like saying, well, you can't do what you're trained to do. And I feel like it's pretty unfair, especially certainly for people new coming in. They've never been allowed to advertise, you know?
Yeah.
And so that's made it really, really hard. And I personally think it's wrong. Obviously it affects us, but and the fact we can't tag someone who's already happy.
Yeah.
It's just
It's
crazy.
yeah,
It's
it's
just, it
crazy.
makes me angry.
And
Nice.
how much of your patients comes from the Instagram? Do you have this number?
Look, years ago I tried to figure all this out, but it was stressing out my staff, keeping track of it, conversion rates, and they give me conversion rates that we didn't do anything with. So I don't even ask patients anymore.
Okay.
Because it just became too hard.
We actually track all of this information. We send out, my practice sends out 3 monthly surveys, and we survey 36 questions. You know, how did you find the receptionist?
Yeah.
Or everything through to how did you find us? What was the most important 2 reasons? And up until about a year ago, obviously coinciding with 1 July last year, it was Instagram. It was before and afters and stuff. Instagram. But now it's become word of mouth because Instagram's dropped off.
Yeah,
a lot.
it happens
It's a lot.
with to me the same.
It's now patients who had, we were talking yesterday, with patients who have sisters or mothers or friends or whatever. And that's actually a really good way to grow you because you build a business from the ground up and it's not this vertical marketing, it's horizontal marketing.
For me, like 2 years ago, I would say like 50 or 60% comes from Instagram. Nowadays, it's only 20. But it's better because it's a better patient because
It is a better patient.
she already know how much you charge. She already know how you deal, so it's easy to convert the surgery.
She comes knowing you, knowing what she wants, how much she expects to pay, so it's easier. The conversion it's higher. It's in Portuguese, so it's a little bit difficult to translate, but I'll try. I have me and my wife will have a business in trying to help doctors and people from health people to earn their money, not being slaves of the work, And we have like this wealth comes from recurrence and indications, so it's much easier when you don't need the social media. Of course, social media it's fantastic, so make you more known. A lot of people know you, it's better and it's a little bit easier, but it's becoming harder and harder because of the regulations and because it's much more expensive. I don't know how is it in Australia. Is it more expensive to do advertising now in the social media, or it's okay? How do you feel it?
I don't know. I haven't paid for advertising for 5-6 years.
That's
And
fantastic.
That was
Oh man.
because
You're living the dream.
because I hated paying for Google. For social media, I don't think I've ever. So 1st of July last year, I actually closed my Facebook page because I couldn't delete all the bikini photos, all the selfies,
Of course.
and every time I tried to delete it, Facebook would put it back. So my only option
To
close it. So Facebook I don't even have anymore. Instagram was easier to delete. I don't know, something about the algorithm. I don't know what you found. So I haven't paid for Facebook ads because I don't have a Facebook page.
Very nice for you.
We very rarely pay for ads. And you can see a lot of doctors who are starting out, and maybe it's the same here.
You
have to pay, right? You have to get yourself known, right? And with the tougher regulations, it makes it very hard. So they're paying, sponsored ads, Google ads, Facebook ads, Instagram, I'm guessing, boosting posts and things like that. But we don't really do it, luckily. So because the brand's big, and like you guys, if you've got big brands, it does it for you. And so that's the best way,
Nice.
But
But Facebook Instagram won't let you boost before afters.
No,
So
it's got to just be other content, right?
Yeah. And the other content, all the lifestyle photos, we're not allowed to post.
Yes.
So we actually can't. The only thing you could boost is photo of your own head, and you go, okay, boost that. Who wants to see that?
But there is a way. There is a good way to do that.
Yeah.
It's not easy, but it's more for you to be known.
Yeah.
There is a book that I'm sorry, but I'd like to
Absolutely.
to give this tip. It's How Brands Grow.
Yeah.
Okay, it's very nice. There is the volume 1 and 2, and he has a position that's a little bit controversial, but it's interesting that he says that for the brand to grow, you must reach out as many people as you can.
Yeah.
And it's not just the people that you really want to treat,
Yeah.
You have to reach a lot of people, because they are going to talk about you and they are going to say that, oh, I don't have the money to go to Bersou, but I would like to be, to have my surgery with him. So if I was you, and if I had your money, I would go to him. And so it makes the brand grow.
Yes,
so it's important to understand that, because sometimes we want to reach out the perfect lead, the perfect person. That's the person that I want to do the surgery. But sometimes many people that doesn't do the surgery with you, they must know you to tell them other people about you,
And but you guys do have like a I don't know how to say, but a lot of patients in a row to do the surgery with you, or if I want to do my surgery with you, I can do next week.
It depends. If you asked that question 2 years ago, it would have been long wait.
Yeah.
But if you're asking it now, it would be like a 1 month wait. But like 2 years ago, it would have been, and also depends what surgery.
Yeah.
So if a patient goes, I want a breast augmentation, 1 hour.
Yeah.
We could always fit in a breast augmentation.
Yeah.
But if the patient wanted body lift, mummy makeover, 6 hours, it's hard to put 6 hours.
Yeah.
You can't sneak a 6 hour case in.
Yes.
So,
unless she's a wife of a shaky,
Yeah.
then you can put it on Sunday morning.
But generally, we say to my patient coordinators is if they're desperate for time and you're going to lose the lead, you fit them in. Like,
I'd agree. We're the same. A couple of years ago, we couldn't get in people even to see us for 3 months.
Yeah.
And they go elsewhere. We all know. But now, maybe it's the same in Brazil. But the market, especially for the aesthetic breast, the implants, the lifts, the small patients, is dying.
It's dropping down.
But the bigger stuff, as Ziggy said, it's probably a month for us. Okay. We do a fair bit of it, like Ziggy, similar practice. So, and that's really for a lot of us who, basically only do this, has kept us going while the other stuff is sort of fallen off the cliff a bit.
Yeah.
And what do you think that is, like, let's see, 2 reasons that your patients look for you? What do you think that's the 2 most special things that makes your patients look for you to make the surgery with you?
Good question.
Yeah, great question. I'd love to say lots of things, but I think one thing that we really always get commented on is the first thing is our staff. That often in Google reviews and in things like that, what do you call them, ratings now? We often get mentioned the staff. From the moment I was met, it's not just about me.
Yeah.
It's about a 360 degree kind of experience where they every other point along the way they get made to feel special. And the second thing I would say then is a bit more about me, but we have very good before and afters, and we put a lot of effort into before and afters, getting them lighting matched, the focal length matched, the same person taking a picture all the time. To me, this is the single most important thing that any Brazilian plastic surgeon coming to this conference should be taking away. Have a good photography studio, because that makes a world of difference.
Yeah.
If you're putting before and afters up on Instagram, show them off. You want to show them in the best light. You want to show your work.
Yeah.
And you so many times you see lighting's bad. It's not a like for like.
Yeah.
So anyway, that's one thing. Those are 2 things.
Just a second. How many employees do you have?
We have 7, of which 2 are full time and the rest are part time casual. Yeah.
Okay.
So just for one surgeon, but we have a nurse injector as well, and a nurse, a clinic nurse, and admin staff.
Your turn.
Currently, we've got 6. And I don't know if they're listening to this podcast. No, but we've got 6. The problem is, at the moment, I've got 2 staff of maternity leave, so I've got 3 people covering 2 jobs. But generally, I think 4 staff for 1 surgeon. That's kind of the ratio. 1 admin, 1 receptionist, practice manager, and a nurse. So 4 per 1 is generally what we work on in Australia, I think.
What about you guys? What's the
2 reasons?
The 2 reasons.
Oh yes. Sorry.
I want to hear it.
I want to hear from you.
I want to hear you.
I want to learn from you.
Well, 2 reasons different from what Nick said. I think I'm pretty brutally honest with patients.
That's
like,
good. Yeah,
and sometimes they say, "Oh yeah, I heard that you're really on." I'm like, I tell them like it's very black and white, and that's helped me a lot. Is just the brutal honesty, and then if I know they're not going to get a good result, the thing that I like saying to patients is, I am incentivized to operate on you. I only make money if you have surgery with me. I'm telling you not to have surgery.
Perfect.
So that just means how much that you, and they like that honesty. They're like, oh, that's very. And any patient that comes in and I spend a very short consultation with, I go, we just don't even charge them. We don't charge them.
Yeah, I do the same.
But we're getting better because now the staff email me and go, are you going to accept this patient or not? Before they even come in. It saves them time, saves me time. Sometimes they sneak through. So I think brutal honesty, and sometimes that's a bad thing, but I think brutal honesty is. And I think probably the rest just comes down to a reputation for doing a certain number of operations. Yeah. I don't do skin cancers. I don't do hands. I don't do burns. You know, you become so focused and super subspecialized, and so they know what they're gonna get. And I'm involved in a lot of the teaching of the residents in Australia. So the teaching aspect, I think they do find out as well. So I'd say honesty and my lecturing would be the two.
Great. And you, Guilherme? It's not because of the price, because he's he's fantastic. So he can charge for what he really
is worth.
Yeah, he really worth. Yes.
I think number one, maybe the honesty, and I care about my patients. Yeah. You know, when they have a complication, I go to the end, man. Yeah. I do all the efforts to resolve, and I don't care about money or how much will cost the dress, or if I have to do a reoperation. I don't care. Nice. I think it's good. And the other thing, I think, is the culture. We build a culture in my clinic, and I have good employees, and I think they transmit this for the patients. I have one of my staff was here, and I hired when she was 17, and she's like me, you know. And the patients feel that, and everybody says, "Oh, you have a great team," and she do a lot of efforts to transmit this for the patients, and I think it's a very positive point.
My clinic WhatsApp chat, the name of it is called Stay Human.
Oh,
so that's for the staff. That's the thing. It was like, it's not called Dr. Moradi Clinic. The WhatsApp chat is called Stay Human. Yeah. And for me, it's a lyric from a musician I really like called Michael Franti. And Stay Human is like, whenever the patient's giving you the shits, whenever anything, just stay human. Use that as a mantra. Yeah. And everything. But I think if you're doing cosmetic work, like you said, you have to care about the patient. Yeah. Look, if a public hospital microsurgery doesn't go so well, they don't care as much, weirdly. It's a bigger operation. Yeah. But cosmetic patients, the discretionary surgery, if you don't take care of them, then the reputation, that's like, you can't be a cosmetic surgeon without having that empathy for the patient. It just won't work. You won't survive.
I just like to say, sorry, Maurizio, I'll let you go. I think you raise a good point, fixing complications. And I think I may have learned that from Kurosh. You've got to fix your complications, and you've got to do it for free, for me. Yeah. It's just what it's the cost of doing business. Yeah. And that engenders you guys so much goodwill, because as the patients say, he cares. He's not interested. He just wants the result for me. And, you know, probably, I don't know, we'd probably have half a dozen, maybe 10 a year. So maybe one a month. Yeah. We go back and we pay the hospital fees. Yeah. They don't pay a cent, because we're charging enough to, you know. And I think
it's like a personal insurance.
It is. And, you know, and no one really asks us, because they know that we look after them, or what's the reoperation rate, and what's the costs, you know, if I have a problem. Yeah. They think it's sort of known. I think this is one of the single best bits of advice you could probably give someone, is you've got to look after people, because they're people. Yes. And that stuff is so valuable. It's better than going to a conference. I mean, going to a conference is great, but that stuff makes huge difference to your practice. Sorry. Yeah.
Perfect. And how about you, Márcio? your turn.
I think it's difficult to say that there is one that is more important, but I really believe I have 2 points that really attracts patients. The first one is our values in our culture, because I'm a very clearly Christian, and I say that a lot in the social media, and everybody that comes to my clinic, they know that I'm a Christian.
Yeah.
And even when they don't are Christians, when they are not Christians, they say I came because I can see that you are a spiritualized person.
Yeah.
They, you know, and they trust me more because of that. And sometimes they say, no, I'm coming because you are Christian, so I know that everything is going well. And then I say, that doesn't, it's not true.
I've got God on my side.
Yeah, of course, God is going to take care of us, but there is the chance of some complications, and I'm going to treat you and I'm going to take care of you. So the first thing, I think, it's the value in our culture, and the second one, it's because I take care of my patients. They say and they know that I take care of my patients, like just you all guys. I think that's the very most important thing that we are talking here, is that we all take care of patients. And in the beginning, I remember when I was starting my career, we had like our teachers to say, no, I'll do the surgery, but you have to pay for the hospital, you have to pay for this, for that, and we don't have space for that anymore. I think, you know, they know that we are doing well. They know that we have beautiful clinics. They know that we have money, and they know what you promised me to make me happier and beautiful, and I'm not feeling that. So you have to do something for me. So I think that's the most important things. These two.
It's funny about the whole money thing. So my mum, unrelated to medicine, once said, if money can solve the problem, then it's not a problem.
Perfect. Yeah.
Right?
Perfect.
So
perfect.
I had a patient, and I had a horrible complication, my first ever necrosis between the belly button and the no liposuction. She had previous liposuction abdominoplasty when we reviewed the case. Full thickness. So that big. Thick. Black.
Terrible.
Terrible. at 3 weeks. And she was uninsured, and she was 4-hour drive away, all the things. And I said to her, look, this is only a financial problem, right? We're going to heal this wound. So you've got enough stress. I'm going to take that stress away from you. I'll cover the costs of things. Not her fault, not my fault. Stuff happens. But I said to her, if money can solve the problem, then it's not a problem. Because yes, this is annoying for you, and it's going to take weeks to heal and multiple operations.
I have a very similar case.
But then I think she appreciated, or I hope she appreciated, when I was going, look, take that away as a problem. Money is a problem. Then we have to heal the wound. You get bottoming out. You say to the patients, it's bottomed out. You're stressed because you feel like you have to go pay again. Let me take that money equation out of it. Now, would you want to fix this 1 centimeter bottoming out? Yeah, doctor, I really would. You know.
Normally, the money is
the biggest concern, right?
Especially in Brazil.
Yes.
Money is a problem.
It's the same here in Australia.
And I think that is for us to have peace. I think that's the first thing, and the second one is when she's not, she's sad, she's not. Oh my, a doctor, it's not like I want, and you just say to them, okay, tell me everything that you are not liking, and I'm going to fix it. Okay, no problem, goes away, because they know they're not going to pay, and you are going to fix, Then, okay, do I have to wait for 6 months? It's okay. Are you going to do it for free? Okay, I'll wait for 6 months. I'll wait for 9 months. So it's becoming, you can go to sleep, quietly and peacefully, because they know they are not going to complain anymore. Just waiting and still liking you, I don't know about how do you think about that?
That's a really good point. I actually like this method. I don't like going to bed because when you have a big practice, he's put a lot of effort into it. I ruminate, worry about the patients, writing reviews. Like it's a thing, and when you've got a big brand and you protect it and you do everything you can, do good work, look after people. But I hate bad ratings or I hate complications. So we do the same, and that's exactly what you made a great point, is that I'm going to fix it and I'm going to take the money out. Okay, it's not going to be necessarily tomorrow or next week. It's going to be a time that suits me. But those two things disarm people, and people often back down very quickly.
Yes.
Yeah. Perfect. And these guys, you know how much they charge for the insurance in here? It's crazy. Do you know?
No, I don't.
Oh, this is a question for you. How much do you think we pay for Ziggy and I? We have big aesthetic practices in Australia.
Yes.
What do you think the dollar is?
For the company or just for you?
Just for us?
I think. Okay, like if you say it's expensive, so maybe like 20,000.
Higher.
Really?
102,000.
My goodness.
Yeah.
So 2 surgeries for you.
Yeah. Well, about a day's work. No.
Nice.
Yeah.
Yeah.
man, it's like when I heard this, it's crazy, and
It's crazy.
But
I'm gonna ask my father-in-law. My father-in-law is a plastic surgeon in Singapore.
Oh, you're right.
Yeah. So I'm gonna ask him, well, how much do you pay your insurance
That'd
per
be even
year?
less. They won't pay much. I don't think. But it's funny thing about reviews, right? So I've got three daughters, 12, 10, and 8. And as they're getting older, before I didn't want bad reviews because I didn't want for patients not to come to me. Now why I don't want bad reviews is that I don't want my children to see the bad reviews. So it's totally flipped. It has nothing to do. Well, it's got less to do with getting more patients. But it's more to do with I don't want my kids to see bad reviews because they come home, they Google you, they see you on YouTube channel, all this stuff. So it's funny how as we get older, your goals change a bit.
Yeah, it's changing. Yeah, good point. I never thought about that, but it's a good point. I think now we are going to the end of the podcast, and as Manfred did, I would like you, all of you, to leave a message for like young plastic surgeons that are starting their careers. What you say to them? Start with you, Nicky.
Yeah.
Leave a message for Brazilians.
Brazilian plastic surgeon or young Australian plastic surgeon. Look, it's a lot harder than when we started. I think you've got to say that to people. You've got to be persistent, and you've just got to keep doing the best you possibly can. For me, every day is just like I treat every patient as my last. It doesn't matter if it was a skin cancer or a mole or a facelift or a whatever. You just got to do every operation as though it's your last. And
good point.
Yeah, you just got to focus, and you can't let anything get in the way. Like chitter chatter, whatever. I like to focus on the operation, and you just got to be persistent. But I think what Ziggy was saying is really is good. Is think of a super specialty, a subspecialty, like a breast and body, or is it face and nose, or is it something else? Because if you're just a generalist, you just get lost in the wash of general plastic surgeons.
Yeah, perfect.
I think so. There's a quote from Michael Jordan, and I think he copied it off Babe Ruth. And they said to Michael Jordan, "Why are you?" and Kobe Bryant as well. "Why are you so intense every game? You got a game every 2." And he said, "Somebody's probably saved money, and this is the only time that they're going to come and watch me play basketball or football or whatever. So that's why I play for that one person, because this could be the only time they ever come and see me." And then I use that mantra for surgeries, like this patient has paid money to be with me. So this is very important to them. We see patients so often, so take every patient seriously. But the one thing that I think of is the patient is about to go to sleep. How do you feel when they're going to go to sleep about picking that operation? Because sometimes you shouldn't be doing an operation. You see the consult, and you're like, this is going to be a disaster. Yeah. I always put myself in the anesthetic bay as they're going to sleep. What level of anxiety am I going to have when? And if you predict that you're going to be anxious when they're going to go to sleep, don't do the surgery.
Perfect.
What about you, Márcio?
I'm going to read the Proverbs. Just finding a easier version of the Bible. Yeah. I think that many people now, not our generation, but the next one, they think that everything is easy. Everything has to come easy because I was born, I deserve. Yeah. You deserve what? Just born. So I think that the plans of the diligent lead to profit, as surely as haste leads to poverty. So you have to be diligent. You have to, to be consistent. You have to put some effort, and not just a lot of effort. and then you have to you can prosper. So I think that's the most important. Don't follow the lead that people that says just it's easy, I'm going to do it, I will do it when I want, the way I want, and it doesn't work. You have to be consistent. You have to follow people and walk with people that have the success in what you want to have.
Yeah.
So you can it's intelligent to learn from your mistakes, okay? But it's wise to learn from others' mistakes.
Mm-hmm.
So it's much wiser. So I think it's that be consistent and walk with people that have success in what you want to have.
Yeah, perfect.
Yeah, I think just be genuine. Stay human.
Yeah, I love that. Stay human. Yeah, and for me, I think it happens with me. I think for a young surgeon would be best to be in the right place with the right people and to have a purpose. Write it down, the purpose. And when you have it written down, every day you read that, it's easier to say no to other things, and you have a focus, a very good focus. So sometimes we were upset because you don't have patients, you don't have surgeons enough, but don't quit, don't take the easy way. It will happen, and it happens to me. Like now, my career are doing great, but it was not like that. And there was time that I think about to quit doing other things 8 years ago, 7 years ago. But I have a purpose. My father is a plastic surgeon, and then my children's born, and you say, oh, this makes sense for me. And nowadays it's easier, and to be in the right place. When I start to go out with this guy, my career
now because we have sorry, the last thing I'm going to say now, but we have this great opportunity, me and Guilherme. There is a kind of job that's growing more and more in Brazil, and it's called derma husband. To be a husband of a dermatologist, So sometimes maybe I should quit, and be a dermatologist.
And doing my wife's business. Yeah.
You married well.
Yeah.
But with the junior doctors that you were saying, you're unconsciously incompetent, so that you don't know those little nuances. So the junior guys and girls there's a few of them. I say to them, send me your photos before and tell me your plan, because you don't know what you don't know, and that's where you make. Yeah. We were lucky; we made mistakes before social media.
That's right. It's actually seriously true. It is about being right place, right time, because otherwise you'd be crucified, for doing this. But you could quietly just go and fix your problem without the whole world knowing. But now it's a lot harder. There's nowhere to hide.
Yeah.
And that's why this job is a very hard job. Like, people are paying us a lot of money, and you just cannot be wrong. You cannot make a mistake. Oh, it does happen, but you've just got to check and recheck and triple check. And I just think where this specialty is very demanding, it's exacting. You've got to have everything planned out and do the best you can, because there's nowhere to hide. Especially as you get on in your practice, you go, oh my God,
Yeah.
Thank you.
This is perfect. Thank you, everybody. It was a pleasure, and we are finished this podcast. Thank you, everybody.
Don't forget to activate your legend, okay? Because it's an automatic legend from YouTube.
Oh yeah.
See you.